Hi, Alan. It's Sunday morning, and we're talking about return to healing. And there's this. We have a lot of topics we want to talk about, but we couldn't resist something that came out just a day or two ago, and it kind of fits the model of everything that's wrong with our medical society all at once. And I have a lot of patients who have come to know my thinking process and how I come up with decision making and shared decision making. And a lot of them emailed me about this new report, which is the new cholesterol guidelines, scripted by two organizations you would think would be somewhat reputable, the American Heart Association, American College of Cardiology, who dazzled us recently, Alan, with their blood pressure guidelines, which basically says push everyone low enough so they faint. And that's how
Yep.
you know that's how you know when we got the right blood pressure. When they're flat on their face on the floor, then we're good. So they came up with these guidelines now, and they the thing that struck my son when he read them was that we're now supposed to be measuring and treating cholesterol in 10-year-olds, and all the way up
Yep.
to 100. That is what we do now. So yeah, it's quite a mess, but it's understandable. If you read our book, you would understand why this is happening.
Exactly. And Andy, good morning, everyone. This is, a perfect example of what's wrong with our healthcare system. Let me start. I'm a little worried because Andy's son read these guidelines on his honeymoon. So at least his wife is a doc too. So that's okay. I got a little scared when you did it though.
Well, when you get
I was like, he's a clone.
when you hit something annoying, it happens whether you're in a honeymoon, in your bed, or in outer space. It hits you.
You obviously have a clone there though.
Yeah, good.
What gets me the most is this is the perfect example of where the medical industrial complex has totally taken over medicine. And anyone, this is your first time with us, the medical industrial complex is big pharma and big device makers and the health insurance industry and hospital industry and the colleges that represent both physicians like the American College of Cardiology and represent more the interests of patients, in this case, the American Heart Association. And what the world doesn't really realize, we think these are the most cherished, respected organizations, and they are by most of the world, because most of the world is not looking into the facts of how these studies are funded, okay, how the devices and the apps behind the studies are funded, all by the same thing, the medical industrial complex. And what this is going to do, what this change is going to do, and I know Andy wants to talk about the details, is add probably trillions of dollars between more blood screening, more CT screening, more drugs, and many of these drugs are really expensive. At least the statins are cheap now. So at least we could say that much. But many of these drugs now, anything second line is not cheap, Andy.
Yeah, it's not cheap, and it's not proven to do much more than lower cholesterol. And that's one of the so if we look at statins, they have a special place in terms of having the ability in some people to lower inflammation within the coronary artery system. So if you're a younger person, and we wrote an article, Alan, on the fact that statins have no benefit in people who are older. And certainly once you cross 80, you have zero benefit. But even as you get older toward that, and 50% of statins are given to people over 80, where we know they don't work. And they're also given to people with high cholesterol, but that's not where they have a benefit. And the biggest randomized study was in JAMA many years ago. And it showed in people who are high risk of heart disease or who have had heart disease, you will lower your risk of having a severe heart attack by 1% with 5 years of treatment if you are in this high risk group. And that's regardless of your cholesterol. So just understand that statins, when they're given to people at high risk, do have this slight reduction in your risk, but not in people with high cholesterol. And that is the biggest confounding part of this study. These guidelines. This is no study. And if you look at the
Right.
guidelines, they're based on garbage studies. They're what we call observational studies, which you take a bunch of people and compare them, but you don't talk about other variables. We know from a lot of data that cholesterol is not a prognostic indicator for heart disease. People with low cholesterol and high cholesterol have about the same amount of heart attacks, strokes, etc. But what they've done, the American Heart Association, which is almost entirely funded by the pharmaceutical industry, its leadership is from the pharmaceutical industry. The American College of Cardiology, which not only takes big pharma funding, but its goal is not to help the patient. Its goal is to help cardiologists. That's why it's there. It's a trade association. The
Yeah.
doctors, as my son said, my doctors are a hoo-hoo of big pharma. I don't care if they're Blumenthal from Hopkins, who's the big guy. Oh, he's a CNN says he's a leader in the industry. Yeah, he's a leader in doing studies for drug companies, which funds Hopkins. And CNN, by the way, its number one reception of advertising funding are drug companies. So this is the complex, Alan, right? You get these academic doctors whose whole lives are to do studies for drug companies. You have the drug companies, you have the drug company front, which is the American Heart Association, the doctor front, the American College of Cardiology, the media, like CNN, which loves this guidelines, all of which the drug companies are loving it because now we're checking cholesterol as a surrogate marker for coronary artery disease. We've
At 9 years
lowered
old.
the and 9 years old. We've lowered what is normal. Now you got to be 70, an LDL of 70, which, by the way, I don't have anyone in my panel who has an LDL that low
Because you're
based
not
on
supposed
nothing.
to. There's no
Right.
real.
It's dangerous. It's dangerous. And they're going to hurt people with these guidelines, but they're going to make a lot of money.
So you brought up another good point. I mean, we could talk about this for a week and not finish it. But the other good point is the media. And like people don't understand, the media is equally bought into this because the biggest funder of commercials now are the drug companies. And wait, you're going to see an ad from the American Heart Association really soon. I'm surprised they didn't have the ad written already. Maybe it's already on TV. I don't watch much of it, but you're going to see an ad from them. Like you got to see your doctor like today, and you got to get more blood tests that you've never had. You must get a calcium score no matter what's wrong with you and what your other risk factors are. Like, so hurry up today or you're going to die like within a week. Like if you don't get it within a week, you're dead. You're a dead man or a dead woman. Women, they give
and,
an extra 5 years, I think, or something like that. And
and
and then and then there are they serious? Treat 9-year-olds? Like you're gonna put a 9-year-old on a stat? It's
oh,
like
yeah, this is where it becomes laughable. And the fact that they could look at this guideline and not laugh and say, "Oh yeah, American public's going to understand. We got to get these 9-year-olds down to LDL of 70." Or, you think any data went behind this? This is an expert decision panel based on
they
drug
all are.
company garbage. That's all it is. And if you don't
They're
agree, you're not on the panel, by
well,
the way.
it's all the evidence is either expert opinions from these two organizations or pharmaceutical funded research. So it doesn't matter how you look at it. We know that what is it, 50% of all research is proven wrong in 5 years or something, Andy? What is
Oh,
that
it's
data?
higher. It's higher than that. It's like 85% are reversed. And that's in randomized trials. Observational trials are nearly 100% wrong because they are designed. And just so you know, in an observational trial, real quick, we've talked about it. That's like saying we're going to look at 1,000 people and we're going to compare people who drive Subarus to people who drive Ford F-150s and see which group has more heart attacks. Oh, wow, the Subaru group has 50% less heart attacks. Therefore, driving a Subaru prevents you from getting a heart attack. That's an observational study, just so you know. And that's
And we
what
know
they
that
use.
that's true because everybody in a Ford is a cowboy eating meat all
Yeah.
the time. Like, oh, but it's okay to eat meat now. Let's see how it goes.
Well, it depends what kind of meat. Depends what kind of meat.
Yeah,
I
what they're
mean,
fed, right?
but it is a demographic difference. I mean, people who drive Subarus tend to be younger and athletic and all this kind of
Come
stuff.
on, we
And
all know who drives
whether that's
Subarus.
whether it's true or not, we don't know. But
Same people who drive Priuses.
Priuses are really, God, they don't have any heart attacks. Those guys. Yeah. What about the Tesla people? I don't even know. But the
Well, they're
bottom
having
line,
heart attacks now that their stock tumbled. It's
yeah,
like,
that's true. I mean, the bottom line is we're now treating a number, Alan. We're not treating inflammation of the heart. I have tons of people who have really high cholesterol and have no coronary artery disease, and tons of people who have really low cholesterol and have tons of coronary artery disease because they eat like junk. And it's the cardiologist, by the way, who put us on a low fat diet so we could eat more sugar and have more heart disease. And
absolutely.
like you said, Alan, the statins are cheap. they're the only medicines in this class that have some efficacy in terms of lowering coronary risk. Again, having nothing to do with cholesterol at all, having to do with inflammation. But these new, unproven, expensive medicines like Repatha and there are others, those are like $30,000 or $40,000 a year. And by pushing the norm of what we expect your cholesterol to be, whether you're 7 or whether you're 107, we're now what this guideline is doing is trying to get people to use these expensive drugs. Well, the
Yeah.
statins are great, but they didn't push the cholesterol low enough. So let's add some Repatha to that too. And then we'll start looking at your amyloid score, which will be the next guideline that comes out. So,
Yeah.
so they just can't get enough of you being scared of your numbers. And that's what this is, a numbers game.
Yeah, and it brings me back to when I was a younger doc, and you'll remember this when the drug Zetia came out.
Oh,
So,
yeah.
so for the folks here, Zetia is a combination of a statin drug with a drug called estimebe, and it's like an add-on drug in one pill that lowers. I think only the total may be like 1 point or something like that, and they got this drug approved. Like pharma pushed the drug approved, truly with no evidence of any benefit. Okay, and then they got it approved to use alone. And I get new patients all the time coming in on this drug, and every time I see it, I laugh because that drug truly has no evidence. Statins have some evidence, but this has no evidence that it does anything to make you live longer.
And by the way, Zetia, which is we talk a lot about in the book too, it's a poster child to me of a non-thinking doctor. So think about your cardiologist. Well, my cardiologist, yeah, but there's not a single study that shows it reduces coronary disease. And Alan, $5 billion of Zetia sales in this country a year. People are still worried about that. And we just crucified another one that when we were younger they used niacin, which does lower cholesterol. And now we said, oh yeah, it does lower the cholesterol, but it increases your death from coronary artery disease. So there's another example of a drug that lowers cholesterol but increases death rate. It's not about cholesterol. And by this guideline making it about cholesterol, they're just exacerbating the problem of this numbers focused medical system. And the numbers focused medical system enables the medical industrial complex to make more people feel like they're sick. Because guess what percentage of Americans, including 9-year-olds, are going to have LDL cholesterols below 70? Probably 1%. So that means 99% of Americans now have a new sickness called high cholesterol that has to be treated with medicines. Because the guidelines say, well, you could try diet first, but it's not going to work. Yeah,
Right.
it's not going to work because diet only makes you healthier. It doesn't lower your numbers. That's the flaw of diet.
At least they put in there it's safe to take the women off during pregnancy because we want the next generation of messed up kids from drugs.
And by the way, I think women out there, once you have that baby, you better, first thing, put a statin in your mouth and in
On
that,
the labor deck.
and
Exactly.
it should be coming out right into the fetus too, because never too early to get those cholesterols down. Now that fetal blood test is also going to include an LDL. So thank God we're going to start early prevention right out.
Absolutely. Maybe we should talk a little bit about, some of the testing stuff, which we haven't touched on yet. So let me ask you, do you use risk calculators at all?
No, risk calculators are designed by observational drug company studies. That's
They're
what they're designed.
designed to give you the result they want you to have, which is
Yes,
give more
exactly.
drugs. Because,
Yes.
you know, the big one now is called prevent. Every one of my residents is like this. This is like they can't present a patient in the office without assessing their risk. It's like in every one of their charts. And they walk around and they put these numbers in. How can the same guideline be the same app or tool, whatever you want to call it, be accurate for someone that's 30 years old and someone that's 80 years old? Like there's no changes between those few years.
Well, they're not ageist like us, Alan. They don't they believe a 9-year-old and a 109-year-old should be treated equally. Their bodies are the same. So yeah, these calculators are designed by drug companies. This is American Heart Association again, and they use some observational data. They have this for atrial fibrillation, for coronary disease, bone density. All of them are designed to make you feel like you're about to die. That's the it looks like, if we don't fix you right now, you're going to die on your way home. So we better get your LDL down today. But that's what and they create this
But not if
false.
you're in a Subaru, because they are safer.
Well, yeah, if you're in a Subaru or Prius, yeah, you don't have to hurry, but you can't drive that fast anyway in the Prius, so that's okay. The whole point is to make this false link between cholesterol and death slash heart attacks. It's not a real link. It's never been proven. It's been invented, and now this is the problem with numbers. You invent a numerical disease, then you can change the norms of that disease by just saying, oh, you got to go lower. You got to go lower. You got blood pressure lower, sugar lower, cholesterol lower. Oh my God, more people are sick. We have an epidemic. And then we have the epidemic. Then CNN's got the epidemic task force, running through and saying, more people got to go to doctors. And look, they're not going to go to us. They're going to go to cardiologists and get stress tests and echocardiograms and carotid screens just to make sure. So yeah, it's turned into a real mess. And I am guessing, Alan, and I could be wrong, that Americans are getting a little smarter about believing this. And I think a lot of them will see this 10-year-old thing. You should start screening at 10 and start realizing that these people are freaking crazy.
Yeah, I don't think the American Pediatric Society signed on to this, but the American Geriatric Society did.
They are the most drug company sponsored society around. So yeah, of course they do. In the
And of course, our
pediatrician,
friends at the ADA, our favorite American Diabetes
American Diabetic
Association,
Association, yeah,
they,
they're
they
working.
should probably say, why test? Just put everyone on a statin.
Well, the reason they want to test it because they're concerned in the American Diabetic Association that the statin will only get your LDL down to 80 or so. So you need that Repatha to really push it, or Zetia to push it even lower. So they just want they're understanding that they don't want you just on a statin; they want you on the new stuff. The American Diabetes Association is quite the drug company front. It's amazing people still believe these organizations are legitimate. That's like asking the National Rifle Association to come up with a policy about guns in schools or something like that. Because they understand guns well. It's the same thing. They're supporting the
Well, they
people.
know that it doesn't kill people, so.
Exactly. And I always said, that you can easily have the oil association, ExxonMobil, come up with our new environmental policy, but it's exactly the same thing as having the drug companies come up with new policies and having these doctors, these real disturbing doctors, because they are high up in places like Hopkins and Harvard. They run the American Heart Association, American College of Cardiology. They have all these articles in New England Journal because they're doing the studies for the drug companies, and those are the ones that end up in those journals. They end up on CNN. So everyone thinks they're smart and objective and wise, and they're not. They are fronts for these companies, and it's really upsetting to see people have that kind of status. And how do they sleep at night, Alan? That's
You know,
what I don't.
and they've heard, and I feel bad for the cardiologists sometimes, especially the ones that are non-invasive cardiologists. So a lot of the cardiologists I work with, are office-based, good people, want the best for their patients, and had a discussion about a year ago with one of them about, I said, well, what do you think the ideal LDL is? And they said, no such thing. You got to get it as low as you can. The lower, the better. It's proven the lower the better. And I said, okay, can you share those articles with me? Because I have two. And I didn't know we were doing this. I don't have the articles in front of me, but there's two really good studies out there that actually show this bell-shaped curve about life expectancy and LDL. And realistically, when you get less than 70 and you get close to 50 on LDLs, there's several studies out there that your life is shortened. I mean, we need fats in our body for metabolism. And when your LDL gets less than 50, your life expectancy decreases.
And by the way, the LDL of 70 to 150. I mean, there's no, it's not even a bell shape. It's a scattergram in
Yeah.
terms of risk. And there is a big article in the British Medical Journal, which is called the BMJ now. Um, I have it on my desk at work. It's about a year old, and it's somewhere on our website. But it shows that there's no bell-shaped curve over age 60. The higher your cholesterol, the longer you live. And what was good about this study is they pulled out people who were ill with diseases that would lower cholesterol. So let's say you have cirrhosis of the liver, your cholesterol will go down, and your life expectancy obviously is lower. Cancer could do it too. They pulled those people out. So just in the normal, healthy or slash frail population, the higher your cholesterol, the longer you live. We have a new study that shows that if you have dementia and you go on statins, you actually have more strokes, more heart attacks, worse memory. We know that these drugs cause muscle weakness, muscle destruction, fatigue, brain fog. In older people, we know that. We wrote an article about it. Increased falls, all this stuff. But all that stuff's good for the medical industrial complex. Let's get people sicker. We could push them to different specialists. They get more drugs for other things that we've now caused. That's the problem, Alan, is it's a downstream effect.
Yeah.
It's not just this. It's going to cause a medical
So
mess.
it's a disaster. So I had a patient in the office yesterday who called me on as an emergency on Thursday night. Can I please call him? It was like a fairly late call. And this is a guy I've been taking care of for close to 40 years. He's a very reasonable guy, a very nice guy. I said, wow, something must be really wrong with this guy. So I called him up and I said, what happened? And he goes, I went to my cardiologist for my routine annual stress test. Like, this is the same story we've told a million times. And it was abnormal. Okay. So at least they didn't send them for a cath right away. They sent them for a CT angiogram that same day. So they sent him right. And this is one of the prestigious Manhattan academics. So now he has the CT angiogram and he's still there that day going for the complete cardiac workup. And the guy goes, you need to have a cardiac cath now. You have 50% blockages in a couple of your vessels. So he goes, no, I got to go do something tonight. How about tomorrow? So he pawned it off until tomorrow. And that's when he called me up Thursday night saying, I'm going for a cath tomorrow morning at 8 o'clock. And I said, are you having any symptoms? And he goes, no, I feel fine. He just said I needed my routine stress test and it was abnormal. I said, was it abnormal the last time? He goes, I don't know. I said, so I can't tell you what to do, but I could tell you that the evidence clearly shows that the treatment of, you know, cardiovascular disease in asymptomatic people should be lifestyle modification. I, I and I wasn't in the office then, and he wasn't even on a stat. Like he wasn't on aspirin. He was on nothing. Like he was just on nothing, and he's got to be cath right away. They put the fear of God in these people.
That's what they do. And yeah, a guy like that he's one of those guys that might benefit from a statin, moderate dose, but regardless of his cholesterol, right? He has plaque. We know he's plaque, or maybe he doesn't. These tests have strong false positives too. But it starts with, oh, I'm just going to get checked out, just to make sure I'm okay. I feel fine. And then you end up being told you're about to die. And that's our healthcare system in a nutshell. These cholesterol guidelines are just another way of pushing us to fear for our health, even when we're doing great. And we will start fearing once we start getting the treatment, believe me.
Well, we've always said we don't have a healthcare system, we have a sick care system. But now we should really start talking about we have a sick care system based on fear. It's like,
Based on fear and based on being sick with diseases we invented. So that's our system. We don't even have real sickness anymore. So we want to treat fake sickness now because that's where the money is. Okay, Alan. So start worrying about your cholesterol now. I'm gonna go and take a home cholesterol test and do a home cath, and just to make sure I'm okay, and then I'll be fine.
sounds good. Well,
Okay, I'll see you next week.
again, perfect example of our sick care system. It's a mess, guys. If you haven't read our book or Return to Healing, you really need to, because this is all we talk about in there.
And we got a lot of evidence that we give you if you ever want to talk to someone who believes in these guidelines.
And only a few pages on how to fix it, because it's really not hard,
Really
but the
not hard.
medical industrial complex just won't let it happen.
No, they want you to feel worse. So there
That's
you
right.
go.
All right.
Okay.
Have a good week.
Bye.